know you do not support single-payer health care, but I also assume you know there is a very strong single-payer health care movement in Pennsylvania.
Yes, sir.
And one of the bills that's probably given the best chance in the country of becoming law, and yet you voted against the Kucinich amendment.
Yes,
that
sir.
would have helped enable that. And,
yes, sir.
I'd like some clarification.
Without a question. And by the way, I want to be very clear, as I have even held a whole day health care summit in April on single payer. I want them, as was mentioned out there, to have access to me. And as a matter of fact, I had another meeting with about 30 of them about 3 weeks ago. And I can go into the reason why I believe, after looking at it, of why I still believe those 11 elements I put up are the best approach. However, here's why I voted against that particular amendment. It was about 2 or 3 in the morning when that amendment came up for a vote. I read it, and I've read the whole health care bill. I went over to see Dennis. I said, Dennis, I could vote for this, except there's one line in it that is disturbing to me. Am I reading it right? And I showed him a line and said, if you happen to have a daughter who has an illness, and the public health care plan option does not provide for the kind of treatment she needs, that you could, provide for cancer treatment but not this, that you could not opt for a private health care plan. He says that's correct. It's strictly forbidden, any private health care plan. I said, okay, I can't vote for it because of that line. And I'm happy to show you the line in it. But it precludes any choice if somebody says, I actually need something a little different from getting it. And I did not feel if one state, I think states should have the ability to choose what they want. Because it was well done, the amendment. It also said in it that the government wasn't going to be given any from the federal government more money to them. They'd have to do with what they got. But because of that one line, and I put this out in letters to everybody who wrote me, and I'm happy to send it to you, sir, and show you the line, that's why I voted against it. And I'm happy to, if we get your email, to send that letter to you and show you the line. And I actually literally asked Dennis if that was my right interpretation. He agreed.
But
question?
If anybody else has any other
Last
questions,
question.
take it at the break.
I just wanted to go back and clarify on the single payer. Did you tell Congressman Kucinich that you would support it if the bill
if that line hadn't been in there,
supplemental?
if that line hadn't been in there, I think I would have supported it.
So you would support single payer if it allowed for supplemental insurance?
I would support it if a state chose to go that way. I think it's a state right to go that way.
Okay, so you're not fundamentally opposed to single payer?
No, here's how I feel. I've told the single payers religiously that, look, here's what I believe. But if this isn't going to work, I'm for universal coverage. I'll move to single payer because we have to get everyone covered. Not only that it's right to do, but economically it's necessary to do. I just believe economically, and to continue the innovation. See, the GAO did a study, and by and large, those single-payer countries that buy drugs from us buy them at probably about 33% what you can buy drugs for in America. To some degree, we're subsidizing them. I think overall, economically, this would be a better way to go and innovatively. We can have that discussion, but I would not preclude out if this doesn't work to go. You know what I'm saying? Having everyone covered is a necessity, economically as well as being the right thing to do. So what I told Dennis, I said, I wish that line hadn't been